We tend to think of childbirth as the finish line, but it's really the starting pistol for another incredibly important period, the fourth trimester. Those first few months are just a whirlwind of change for both the mother and the newborn. So, what does high-quality postnatal care actually look like on the ground? Well, today we're going to dive into the World Health Organization's definitive global guidelines to figure that out. And the stakes during this time are, and I mean this, incredibly high. Just look at this number. The WHO's data shows that infections are responsible for nearly half, 47.6%, of all neonatal deaths that happen between 8 and 28 days after birth. That's a staggering figure, and it's a powerful reminder that getting this right isn't just helpful, it is literally life-saving. So we throw around this term postnatal care all the time, right? But what does really good evidence-based care actually involve? To get to the bottom of that, we're going to break down the WHO's comprehensive framework, and we'll start with the absolute foundation of it all, the health of the mother. Yeah, the WHO is crystal clear on this. A healthy start for the entire family begins with a healthy and supported mother. So our first section is all about the crucial interventions for both her physical recovery and, just as importantly, her mental well-being. With so much advice out there, a lot of it conflicting, it can be totally overwhelming. That's where the WHO's evidence-based approach really cuts through the noise. For instance, it recommends simple things like using ice packs for perineal pain. But it also explicitly says not to give mothers routine vitamin A supplements because there's just no evidence it prevents illness or death. This kind of clarity is absolutely vital. Now, one key recommendation for physical recovery is something called pelvic floor muscle training, or PFMT. Basically, it's a targeted exercise program designed to strengthen those core muscles that support the bladder, bowel, and uterus, all of which, as you can imagine, go through immense stress during pregnancy and childbirth. And why is this so important? Well, while we're still gathering more research on the long-term effects, the early evidence is really promising. It suggests that PFMT can significantly improve urinary incontinence in those first 3 months after birth. The WHO sees it as a key, low-risk way to help the body heal from what is a very common and distressing postpartum issue. Of course, a mother's health is not just physical. The WHO strongly recommends screening for postpartum depression and anxiety. But, and this is a critical but, it has to be linked up with actual diagnostic and management services. The guideline is adamant. Screening people without having a clear path to get them the care they need is pointless and can even be harmful. All right, so we've covered the mother's health. Now let's shift gears and focus on the newborn. Giving them a strong start involves a whole series of evidence-backed practices, and you might be surprised at how simple yet profoundly effective some of them are. Take this one, for example. Delay the newborn's first bath for at least 24 hours. I mean, it sounds so simple, right? But this little act helps the baby regulate their body temperature, it saves precious energy, and it allows for more skin-to-skin time with mom, which is just crucial for bonding and breastfeeding. Now, this next practice, this has been at the heart of one of the most successful public health campaigns in modern history. The WHO strongly recommends placing babies flat on their backs to sleep. The evidence is just overwhelming. This simple change dramatically reduces the risk of sudden infant death syndrome, or SIDS. The guidelines are also big on universal screenings, basically catching any potential issues as early as possible. This includes things like checking for eye abnormalities like congenital cataracts, and also checking for jaundice. In fact, they recommend using a quick, non-invasive tool to check bilirubin levels before a baby is discharged, just to see who might need a closer look. So we've covered the mother and the newborn. But here's the thing, high-quality care doesn't just happen in a bubble. The final piece of this puzzle is the larger system of support that surrounds them. That means health workers, partners, and the entire community. Access to care is a huge hurdle, especially in rural areas. So the WHO recommends a bundle of 4 interconnected strategies to build a strong rural health workforce. This covers targeted education, supportive regulations, financial and non-financial incentives, and real professional support. It's not about finding one magic bullet, it's about tackling the problem from all sides. For the longest time, postnatal care was often seen as just the mother's domain, right? The WHO guideline really challenges that thinking, asking a critical question. How can we do a better job of involving fathers and partners? Because we now know their involvement is absolutely vital for a healthy family. And there's real data to back this up. Just look at this study on couples education. The evidence suggests that when partners get postnatal education together, it leads to things like a more timely initiation of modern contraception. It just goes to show that involving partners isn't just a nice idea, it leads to tangible, better health decisions for the whole family. Okay, finally, let's talk tech. The WHO actually recommends using digital tools, think text messages or apps, for what they call targeted client communication. This just means sending personalized health information, appointment reminders, or helpful alerts directly to new parents. It's a really powerful and scalable way to support families, with one very important condition: data privacy has to be protected, always. So, we've gone from pelvic floor exercises to digital health messages and everything in between. What's the big picture here? Well, the key takeaway is this: effective postnatal care isn't just a checklist of things to do, it's an entire system of care. And this really is the core philosophy of the WHO guidelines. True postnatal care is a comprehensive support system. It addresses physical health, mental well-being, and all the social structures that allow a new family to not just survive those first few months, but to actually thrive. And that brings us to one last thought to leave you with. While the WHO provides the clinical framework, real support, as we all know, extends far beyond the hospital walls. So I'll leave you with this question to chew on. Beyond all the official checkups, what is one tangible way your community could better support a new family that's navigating their own fourth trimester? Something to think about.